Today let's talk about inflammatory back pain and nerve pain. Can inflammation in your back cause nerve pain? As executive moms, when you're dealing with back pain, that's challenging enough, in addition to your everyday work life, your family life, etc. On top of that, if you get nerve pain, that is like a double whammy and it can get very challenging. So, in today's video, we're going to understand the connection between these two kinds of pain, that is inflammatory back pain and nerve pain, and how they can affect each other, how one can exacerbate the other one. And this is all crucial if you want to find effective and long-term pain relief. Let's talk about inflammatory back pain, what exactly that is, and how does that lead to nerve pain, and how they are related to each other. Now, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain despite low energy levels and brain fog, or mom brain, as we sometimes call it. And I do all of this by giving you simple exercises, some easy lifestyle modification, some tips and tricks that have helped me in my own pain journey despite adrenal fatigue. So, this is a condition that I suffer from, which I have managed quite well, I would say, which made me have low energy levels and a lot of forgetfulness, or a lot of brain fog. I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people. All right, so let's get into the topic for today, which is, can back pain or inflammatory back pain cause nerve pain? And what do executive moms need to know about inflammation and nerve pain? All right, so let's first talk about what is inflammation. Now, inflammation is a natural response of the body, or the body's immune system, to an injury or to an infection that happens in the body. It is meant to protect and heal, of course, but sometimes when it gets chronic or goes on for a very long period of time, it can lead to persistent pain and health issues. Inflammation can affect any part of your body, but today we're going to talk specifically about back pain. So, back pain can be mechanical or inflammatory. So, today we're going to talk about inflammatory back pain. If you're interested in knowing more about mechanical back pain, you can go to my YouTube channel where I've done a video specifically on mechanical back pain, and you can have a look there. Or you can go to YouTube, type my name, Swati Prakash, back pain, and all the topics under back pain will come up, including mechanical back pain. All right, so uh, let's talk more about inflammatory back pain. Now, what exactly? Uh, okay, let's first see what causes inflammatory back pain. Now, it can be various sources. It could be a repetitive stress injury. It could be a poor posture. It could be autoimmune. I mean, there is a wide variety of causes for inflammatory back pain. But what exactly does inflammatory back pain feel like? So, the very specific and very typical, actually, not specific, typical signs of inflammatory back pain are morning stiffness. So, pain and stiffness that you wake up with, but it improves as you get into a hot shower, as you do some movements. But if you are resting in bed, just when you wake up, it can feel quite stiff. Your back can feel quite stiff. And it can also manifest as a persistent pain that lasts for more than 3 months or so, and it does not improve with rest. Usually, when you compare it to mechanical pains are um, opposite. So, a mechanical pain, you will have pain as you go on about with the activities of the day, the pain starts to come on. But with inflammatory pain, you wake up with the pain. As you do movement, it gets better. So, your pain feels less. Uh, Inflammatory pain can sometimes be pain that disturbs you in your sleep and comes on as night pain, and it does not get you do not get any relief when you change your positions. Now, let's look at nerve pain. Now, nerve pain, if you've seen any of my previous videos on nerve pain, you would know that nerve pain can have a wide variety of manifestations or symptoms. A nerve pain can be tingling, numbness, burning, just a pull or a very uncomfortable feeling down your arm or your leg, depending on where your nerve pain is, because we have nerves. For example, let's look at sciatica. So, sciatica is basically an inflammation or an irritation or compression of your sciatic nerve. Sciatic nerve is very commonly impinged because it is one of the longest and thickest nerves in your body, running from your lower back. So, quite a few vertebrae in the lower back where that nerve roots are coming out, and they join together to make this sciatic nerve that runs along your bottom, back of the thigh, back of the leg, and down in the foot. Now, when you get sciatica, you can have pain in all or any of these regions that I just described, from your bottom down to your foot. Now, with sciatica, what happens is you feel this. Either of these symptoms that I spoke about. So there's this range of symptoms. But why? Because a nerve is, if you cut open a nerve, it's like electric wires. They're like little wires running along. So you have these nerve fibers. Every set of fibers will carry a different sensation. So if I have sciatica and I get tingling numbness in my leg because of the sciatica, and another person has sciatica, they might find burning sensation down their leg. So depending on which fibers within that sciatic nerve are getting compressed or irritated because of the inflammation of that nerve, that specific symptom will come up for that person. So one episode of sciatica can be different from another. The symptoms of one episode of sciatica can be different from another episode of sciatica in the same person and between the two people. So, another thing that I wanted to address here, let's looking at my notes here. Yeah, so basically, that gives you an idea of what a nerve pain would feel like, what an inflammatory back pain would feel like, but what is the connection between the two? Now, when you have an inflammatory back pain, for example, as I said, there can be many causes. For example, if you have a disc issue, so you have a bulging disc, that disc is bulging out of its place to whatever extent, suppose it goes and presses on that nerve. Or there is a herniated disc, so the material of the nerve of the disc is coming oozing out, and it is irritating the nerve that passes along the side or in that area of the spine. So that would lead to an inflammation of the nerve in that area. Now, whatever fibers are getting pressed in that nerve, you will find those symptoms manifesting as your nerve pain. If this is too complicated, just understand that disc issues can lead to irritation of the nerve, leading to inflammation in that area, and that can lead to nerve pain. So that is the simplest way I can put it as to what is the connection between your nerve pain and the inflammatory back pain. Now, yeah, so what can you expect when you have nerve pain due to inflammatory back pain is you can have persistent pain. Of course, it is very unlike muscle or joint pain. And nerve pain, as I said, could be stabbing, burning, tingling. So it's a very different kind of pain, so you can recognize it. And there can be swelling and redness in the area. There can be reduced mobility. This could be also because of your back pain, but also from your nerve pain. So you can have reduced mobility, you can have numbness or weakness. I know I'm repeating a few of the symptoms I talked about in the nerve pain, but this goes along with your back pain as well. Now, how does it matter if you have these symptoms of nerve pain that's coming from your inflammatory back pain? Now, of course, there's decreased productivity at work, there's emotional stress because you don't know what's happening. You already have back pain. On top of that, you're getting this nerve pain. You don't know if they're two separate issues, you don't know if they're connected to each other, and what should you do? Should you treat the back pain first? Should you treat the nerve pain first, or both together? Of course, that's for your doctor to decide, but it's always good to be an active participant in your healthcare plan with your doctor. And if you have disturbed sleep because of these aches and pains, it leads to fatigue. And if you already suffer from low energy levels, from brain fog, it is not a good idea to have that disturbed sleep because these can exacerbate your energy levels, your low energy levels. It can lead to more brain fog. All right, so this is the connection that I wanted to highlight in today's video between your inflammatory back pain and your nerve pain. Now, if you are looking for some simple and easy exercises that you can do, some quick exercises that you can do to manage your nerve pain, I have made a free guide for you, which is called Quick Office Stretches for Nerve Pain Relief. Of course, you can do them at home as well. What I mean is you can even do them in your office. So it just takes 2 to 3 minutes of your time. You could do it every hour, every 2 hours, depending on how much time you have. Now, I have left this free guide in the in a blog, and you'll find the link to that blog in the description of this video. If you're watching me on Instagram, the link is in my bio. If you go to the blogs, you can find it there. If you go to the freebies, you can find it there as well. Also, I will leave a couple of few other important pieces of information in the blog, so it's a good idea, if you resonate with this video, go and have a look at those blogs as well.